His other interests involve outcome research, evidence synthesis, and educational research. And I think we are really thankful for him to talk about how to write a case report, which a lot of us may struggle, especially if we don't have much of the research background. And this webinar is presented by Nishta Research Council, which is one of the committee of the Nishta alumni of North America. So I would like to start, and I will like to start Zain to start his presentation. Thank you.
Thank you so much, Zishan and Nishta Research Council for inviting me. So this talk, writing a case report, should serve as a primer. So when I give a talk like this, my focus is always on why you should do something that is being discussed. Like, why should write a case report would be the main theme of the talk, because honestly, how to write a case report and what exactly is a case report, you can find hundreds of resources on that on YouTube or anywhere on the internet. So let's start with what's my take on Nishta Research Council. I think it's very, very important to introduce, since this is going to be first of our many presentations. Like, who are we? What's our purpose? How do we envision things? And that's strictly going to be my own perspective or my own contribution. And in the other subsequent webinars, every presenter is going to give their take. Okay. So if you're not familiar, I would like you to familiarize yourself with this concept of golden circle, which motivational speaker Simon Sinek introduced many years ago in his TED Talk. And this concept, although originally was described in marketing or business, but if you look closely, this concept can be applied to pretty much anything you do. So whenever you embark on a new journey or try to find a new challenge for yourself, normally we are fixated on the what and how to do something, often forgetting why are we interested in that particular thing. And this concept of why is very, very important, as this is completely pertinent to the amount of effort you put in, the amount of self-motivation you can put in to a particular topic. So here, I'm going to describe my why, or how my vision is for the Nishta Research Council. And again, this is strictly my own personal perspective. So as I envision Nishta Research Council, it's a group of early career physicians. Most of us are in academics or overwhelmingly doing a lot of academic work. Most of the people within the council are from United States. Some of them are partnered from other countries as well. And our overall theme, or like why we are sitting on a Saturday doing all of this, is to pay back and basically train some of you people in methodology, so you are able to carry out some research activity on your own within the limitations of our bandwidth, provide some direction and some mentorship. And above all, like the most important thing, as I envision it, is to basically change a complete culture and establish a culture of research in our alma mater, Nishta Medical College. So let me start with my story, like how I got to where I am. And, then you will get some insight on how somebody who comes from the beginnings that are very similar to where you are right now, and hopefully you'll be able to trace this path forward. So when I entered Nishta Medical College, I had absolutely no idea what I want to do with my life in the long term, which I hope things are different now, but 13 years ago, things were mostly like that. It was, social media was not that powerful. We had very limited interaction with our seniors who had already traveled these paths. So I was clueless. And as I look back and see my research journey, I think it's important to mention some highlights so you can create similar paths for yourself. Okay, so I started Nishta Medical College in 2007. I graduated 2012, N56. I wanted to focus on research in my career. So I opted to do residency in an academic institution and a university program, and then I later on carried on as faculty. And along the way, I'm just gonna take 2 or 3 minutes to give you some brief highlights on how you can get started on a similar path to research, okay? So first of all, the number one thing you will need in research is basically to find good mentors who can mentor you in research, in your clinical skills, and overall. So if anyone has watched the movie Kung Fu Panda, it's one of my all-time favorite movies. There is a master chief who basically teaches Kung Fu and in general principles of life. So here I'm gonna highlight people who have mentored me, not only in research, but in multiple other aspects of my life. I'm sure all of you know Dr. Arbaz. He was the best graduate of a class couple of years senior to me. He's also leading the Nishta Research Council along with Dr. Zishan. And Dr. Kamran Mushtaq, he was the best graduate of the class 1 year ahead of me, and he has mentored me throughout my USMLE journey. So the first lesson, well, I should rephrase it. I'm too young to give lessons. I have still to learn a lot of important lessons. So the first takeaway is, if you want to get started on this journey, you absolutely have to find a good mentor, somebody who is already accomplished and somebody who's really interested in your career development and career growth, okay? So the next takeaway is basically you have to find your why you want to do research. And the bigger your why is, the more you're gonna get out of this and the more purpose you will feel in this journey. Because you can ask any researcher, it's honestly very, very tough to sit in front of a screen for 10, 12 hours straight, read hundreds of papers, and then put your thoughts in the form of manuscripts. So unless you are truly invested or unless you truly have a motivation that is not very short-sighted, that it's perfectly fine at your career stage that I need research to put something on my CV, to get into competitive residency, or for us early careers to get promoted and all that. It's fine, but I want you to rephrase in your mind these things as byproduct of your why, not the sole why itself, okay? So for me, the why in research is, within a lifespan, there is a very limited amount of clinical work you can do and the number of patients you can help clinically. But the amount of work you put in research, that has a tremendous impact that goes on more and more with the passage of time. And it keeps going on even when we are no longer here in this world. Okay, so that's my why for research. And this is the thing that gives me motivation to keep doing more and more research. Okay, now it's very important that you not only find your why, but despite your changing and challenging circumstances, you basically stick and persevere to that particular purpose, because that purpose and that why is going to motivate you when you are 12 hours down sitting in front of a computer working towards your goal. So after that, it's important to do some soul searching. You have to find some skill sets, things that you're already good at. You absolutely have to learn a lot of new things you're not good at, and then constantly unlearn those things and learn some new things. So it's a constant evolutionary process. It's not gonna be like your medical school where you learned physiology and anatomy and you're constantly building towards your clinical medicine and that's it. So in the sphere of research, things keep changing every day, and it's a constant process of learning and unlearning what you already know. So be prepared for that. And I say that from a personal experience, that my very first manuscript, I thought I had given a lot of effort. And when I sent it for feedback, it was a alien concept that in light of that feedback from a mentor, I have to revise this 3 or 4 more times. So be prepared for rejection, for feedback that is uncomfortable at times. So this is part of the learning process. Now, I know that most of the audience here is not from United States, and being through the system back home and in the countries, I know clinically we are very busy. We are serving a lot of patients with very limited resources, and honestly, we are doing a very good job at that. But of course, that has a price, that amount of clinical work often leads to some compromise in the amount of research and the resources available for research, okay? So what I want you to do is basically not get fixated on the weaknesses and the limitations of the system, but in this internet era, there is really no limitation to the amount of research you can do. I have seen people make amazing careers in research just with the help of a high-speed internet connection and willingness and motivation to work hard, okay? So let's start on how to write a case report. So again, going back to the concept of golden circle, why you should write a case report, okay? So most of my talk is gonna be focused on why. Once you master this why of the case report, you're automatically gonna know how to write it and what exactly is involved in the whole process, okay? So this is my main takeaway. And if you want to go away after this slide, it's perfectly fine, because that's 90% of the message I want you to take home from my talk. For all of you who have no research background, the only reason you should write a case report is to break your mental barrier about research, okay? So I know to all of us who have trained from medical schools outside United States or outside the very developing countries at cutting edge of research, we have no research exposure, and just getting involved in research creates a lot of panic, a lot of anxiety. All of this is a black hole for us, okay? So that's the number one reason why you should write a case report, is just to break that mental barrier and get started on this journey. You've often heard that it's very hard to take the first step. Every step after that comes very easy and very naturally, okay? So for half the audience who have something else better to do, you can just close this out. This is the message. You have to break this mental barrier of getting involved in research by writing through a case report, okay? And again, another why is we are mostly operating here. And I am very nervous putting this slide in front of 2 renowned psychiatrists in my audience, but this is a concept you should get familiarized with. There is a fixed mindset and a growth mindset, okay? I will encourage you to not only fixate at your problems, but look at them as opportunities, okay? Let me give you an example. I know in our outdoors and clinically, we are seeing oftentimes hundreds of patients in a single setting. So a fixed mindset will say that I'm clinically so busy that I don't have time to do research, okay? Whereas a growth mindset will say that in developing countries, if they are seeing 10 patients in a week, and we are seeing hundreds of patients even in a single day, we have tremendous opportunity to do research on those patients, okay? So I will encourage you just to Google this concept of growth mindset versus fixed mindset and learn more about it. And you will be amazed at a lot of limitations you see in your daily life. You will try and start looking at them differently, okay? So in addition to the main why of breaking a mental barrier, there are some very valuable skills which writing a case report will teach you, okay? It will familiarize you with the process of doing a literature search. It will familiarize you on how to work professionally as part of a team that is dedicated towards a single goal. And it will teach you some very important lessons in professionalism, how to commit, how to follow through on deadlines, how to do a good job, and how to be very thorough and precise. And most importantly, how to be a good mentee, because I imagine your first project is going to be as a mentee. It's also going to teach you some skills about scientific writing and the process of submitting to a particular journal and ultimately publishing something. Okay. Now, a good example I always like to give is that by the time you are done with your medical school, you have tremendous amounts of medical knowledge in your mind. But unless you apply that knowledge to a particular patient, that knowledge is of no use to you. And you learn that during your clinical training and your internship and house job. And I can give you 10 hours of lectures on how to treat a patient with heart failure. But unless you yourself, under some supervision, are actually personally responsible for managing dozens of patients with heart failure, you're never going to get okay. Actively learn by finding resources on the internet. YouTube has hundreds of good resources, but at the same time, keep a good balance of theoretical learning with direct application of that knowledge. That's how that knowledge is going to stick. Okay. So now let's move on to what constitutes an interesting case, or what is an interesting case report. Okay. So there are three main themes. There is a fourth theme that's not as important. The one we automatically go to and fixate on is rare diseases that have a common presentation, or rare diseases with an even rare presentation. However, in my limited experience, the best case reports are not the rare diseases. They're common diseases that tend to have a rare presentation. Okay. Similarly, there are other themes, and the word presentation here not only is limited to signs or symptoms, because that's commonly what we automatically fixate on. The presentation would mean that a common disease having some rare symptoms or signs. It could easily mean a rare etiology of a very common disease, or a rare association of a common disease with something that's less known. Or it could be a novel treatment. Okay, let me give you an example. Heart failure is the most common reason for hospitalization here in the United States. Okay, so how can you write a case report about something that's the number one cause? So it can have rare associations. Okay, it can be associated with some rare etiologies, like some parasitic infestations or some rare types of heart rhythm problems, or some very rare congenital disease or valvular pathology. So although the end result is still heart failure, now it is associated with a rare etiology or with a rare other disease, or you are approaching it in a manner that has been rarely described before. Okay, I'm going to elaborate on this concept later. So why am I arguing that common diseases with the rare presentations are the best kind of case reports? Okay, first of all, be practical. They're easy to find. You are much more likely to see a common disease in your clinical practice as compared to a rare disease. It's absolutely important for your audience or readers to know about that common disease that is presenting in a rare fashion. And as a result of both these things, automatically they're going to be easy to publish. Okay. Now, how to find curious or interesting cases? I think the most important thing is to keep a very investigating mind. And I can guarantee you, once you are done publishing your first case report, you're going to have a shift in the way you approach clinical medicine. And as you evolve in this process, you're going to automatically start looking at every case as a potential case report and try to find unique aspects. Because I'm telling you, those cases are always there. It's just you're looking at them from a very different perspective, and you just have to shift your perspective, and suddenly those common diseases, you're going to start finding things that you never thought of before. Okay, so you have to keep thinking about these cases and do good literature search. Let's look at this particular concept with the help of a case example. Okay, so now we are moving on to how you're actually going to write a case report. It's a simple 3-step approach. Okay, and all these steps, in terms of difficulty, this is going to be the most difficult, this is less, and this is going to be the easiest part if you have done a good job in step 1 and step 2. Okay, so now I want to make this session slightly interactive. So I want you, all of you, to use your raise hand feature and tell me how many of you in your clinical practice have ever seen a patient with diabetic ketoacidosis. Because the case we are, okay, I'm seeing a couple of hands, a lot more now. Okay, excellent. So how many of you currently think that it is possible to publish a case report on diabetic ketoacidosis? I want to see some thumbs down here in your chat. I mean, it's a very, very common condition, right? Like everybody sees it. So how can this be a case report? That's absolutely insane idea, right? All right, let me walk you through a case. And this is a real case because of HIPAA reasons. Some of the identifiers have been removed, but this is a published case, so you can see it later. So this is a case I saw in my intern year. 59 years old gentleman, known history of type 1 diabetes, presented with the classical diabetic ketoacidosis symptoms in the setting of non-compliance for last 3 days with insulin. Okay, so on his vitals, of course, he was very tachypnic, hypotensive, tachycardic, and important to note here, very hypothermic. On physical exam, we noticed some pertinent positives, that although he was oriented to place, his pupils were dilated and non-reactive with absolutely no light perception. Although his fundoscopy was normal with no obvious signs of any pathology. Okay. On his labs, for some of you, these units may be different than what you use back in your clinical practice. So simple way to know that this is a crazy high glucose value. Okay. And for pH, it's very acidotic. He had ketones, some element of respiratory alkalosis, high anion gap. And in light of his clinical presentation, of course, we had to check for all the common intoxications that could masquerade as diabetic ketoacidosis, like things like methanol poisoning or polyethyl glycol poisoning, things like that. Okay. So in a typical fashion, some of you in clinical practice are familiar with this approach. We basically started working towards making this patient feel better, insulin infusion, some warm saline, and basically all of his symptoms improved after 16 hours. His vision initially presented some vision complaints, returned back to normal, fundoscopy, everything was normal, okay? So now I want to pause here and again want you to use your chat feature and tell me if you've been able to identify anything interesting or unique in this case. Okay, let's make this interactive. Use the chat feature and tell me what things you find that are interesting or curious about the case we have discussed here. Excellent. Temperature, yes. Hypothermia is not a very typical presentation. Loss of vision, yes, absolutely. That's not a classic feature. And once we are done with this webinar, I would encourage you to go back to your textbook of medicine and verify what I'm telling you, if these things are characterized as classic DKA presentations or not. Absolutely. So most of you are picking up the point very well. Thank you. So this is, again, a summary of what I thought was interesting. By that time in my intern year, I had seen at least a dozen cases of diabetic ketoacidosis. As an clinical medicine operating in the outpatient world, I knew vision problems are very common in patients with diabetes, but the sudden onset blindness, that was bugging me, that's something that's not fitting, okay? And even more interesting thing was, as soon as the pH corrected to more than 7, the blindness was reversible, completely reversed, okay, in the setting of diabetic ketoacidosis, okay? So this was our final diagnosis that, okay, something interesting is going on here. So this patient has reversible blindness as a presenting manifestation of diabetic ketoacidosis. Now, another important point, you have to be thinking about these things in real time when you are treating that patient, because that will enable you to expand on your differential diagnosis and do a real-time search for these things, which is clinically absolutely important, but also important from the standpoint of ruling out things that could masquerade as the rare thing you're imagining there, okay? So in real time, we were thinking about these things. That's why we were actively working towards obtaining appropriate consults and imaging for ruling out these other conditions. Now imagine the most common theme I see. Okay, I see an interesting case when I'm working in the ICU, but I'm working in the ICU, so I'm very busy. I'm going to bench this case, and 2 months later, when I have an elective month, I'm going to go back and identify and try to write it up. So I think that approach is flawed at many levels. You have to be thinking about these things in real time. So I hope by now you have some insight on how to identify an interesting case. Now let's move on. What I did next is search on the common platforms if others have seen similar cases, okay? And you have excellent YouTube videos on how to search these platforms, so you can do that easily, even if you don't know now how to do that. And these are some of the questions that were going through my mind, like how many similar cases? What makes my case unique as compared to previously published cases? And then again, you have to analyze if it is still worth to go to the next step, okay? So these are the answers. I found only 3 cases at that time. All of them were in ophthalmology journals, no internal medicine journals. And I thought it's absolutely worth it to pursue this as a case report, okay? Now, step 2, before you email somebody to mentor you for this case report, I want you to do this homework by yourself and actually write what makes your case unique as compared to already published cases. I have made this mistake so many times. I thought this case is interesting. My next step, instead of doing my own homework and searching these things out, was to just email my mentor that, okay, I think this is interesting, deal with this information. So I think that's the wrong approach. You have to do this homework on your own, identify that case, read similar cases, write on a paper what makes your case interesting. So this is what I thought. Only 3 cases, so it's still rare. No internal medicine journal had published this before. Diabetic ketoacidosis is very common in internal medicine, and it is important for clinicians to recognize a transient blindness can be a presenting manifestation, okay? And somewhat important to hypothesize or describe the mechanisms of your findings, okay? So you are done with literature search, step 2. The third step, which I know all of you are very afraid of this step, but trust me, this is the easiest step, okay? This is absolutely the easiest step in writing the case report. The hardest step is step 1, After that, it's step 2. Okay. So let me walk you through this exact case on how we wrote it. So step 3 has 3 basic elements. Everything you will write, it has a certain structure. So this is just like filling out forms or applications. You have to fill in something under your headings, and by the time you are done filling out all your headings, your paper is done. Okay. So the basic 3 elements are introduction, presenting your case, and discussion. Okay. So what goes under an introduction? Okay. It's very important to be brief. In 2 or 3 sentences, you have to give a clear message on why this case is important and a 1-line summary of what we are talking about. Okay. And I'll give you an example later. Next, why is it interesting? So acknowledge the difference. The first sentence was a basic background and importance, why it is important to read what I have written below. And next thing is what makes it interesting, and then a 1-line summary. Okay. So this is that exact case as the case was published. So basically diabetes has multiple ophthalmology or ocular complications. DK is very common. This complication is reported 3 times previously. A brief insight to expand on the background that ischemia is the common cause of painless vision loss. It is rare for conditions like ischemic optic neuropathy to present with complete blindness and a complete recovery. So here you are engaging your internist, because the moment you are mentioning a differential to an internist or a neurologist, their mind is automatically going to zone into their differential diagnosis, and they're going to try to dissect out, did you rule out this? Did you think about this? So you have answered all their questions, and basically now they're hooked to read your case. Okay. And here is a 1-line summary that we describe this case like this. Now, next section, case presentation. It's very, very important to be very brief in this part. Okay. So it starts with history, basic exam, labs, imaging, and then you describe your outcomes and how you manage. Okay. These are the general rules. It's going to take you at least 4 or 5 case reports to get this perfect. But what I want you to take away from the writing section is that everything has a structure. You cannot randomly put your thoughts in every section. You can use these headings and just fill these out. Okay. And then your case will be beautifully structured. Okay. Now let's move on to what exactly happened to this case. Okay. So this is my HPI. Notice how brief it is. It's just single paragraph. The same thing you have read. Here is a brief section on the physical exam. Here is my differential diagnosis. And here is a very, very short paragraph on the treatment and outcome. Okay. So again, important to be concise. Everyone who is reading this section should know that you are a remarkable clinician and you do things systematically and you think broadly. Okay. So next, it's important to highlight your labs and images in the form of illustration. So this is basically a graph of this black window represents when the patient's vision started returning back to normal. So notice as the blood glucose is going down, the vision is completely returning back to normal. As the pH is going up, vision is coming back to normal. And these are again just surrogates of how acidotic the patient was. Okay. So now instead of reading the paragraph, they can just look at it and understand your point that, okay, the return of vision is related to an hyperosmolar state from high blood glucose and severe state of acidosis from your DKA. Now you don't have to sell that in 4 or 5 paragraphs. They can look at this diagram and pick up this point. Okay. In the discussion section, again, it is 100% structured. Okay. Mention your differential diagnosis, compare with already presented cases, give some insight on the mechanism on why this is happening. Okay. So here, let's take a second to read this. blindness for 3 days in association with DKA and a pH less than 7 that is completely reversed. This is an important word, completely reversed, so that they cannot argue that they had some underlying eye problems. Highlights a striking example of this metabolic complication. Now I'm mentioning a differential diagnosis, and then again reinforcing my point that this rare complication was also the presenting manifestation in our case. Okay, now here is a very brief paragraph on how my case is different from the cases that are already published, and I'm of course going to summarize that in the form of a table. So if they don't have time, they don't have to read through this, they can just look at the table. Okay, now here is some mechanistic insight on why I think this happens, that again tells them that you are not just seeing patterns and putting them on paper, you have some logical thought on why this pattern is happening. Okay, so here is a small paragraph on the mechanism, and there you go. Okay, so that's how I want you to approach the common cases you are seeing. So important summary points are: keep an open mind. Whatever common presentations you are seeing, read the case in detail and try to identify some interesting or rare or unusual aspects. Do a literature search in real time, and then do your homework before emailing it to your mentors that I think this is interesting. Okay, so again, if you have to remember one slide from the section on writing and on basically how to write a case report, in addition to the why, it's this slide. The moment you are able to put 3 important points, what makes your case unique as compared to already published cases, in that exact moment, at least in my mind, your case report is already accepted, provided you follow through on your writing part. Okay, so again, write up is the easiest and honestly the least important part, because it is dependent on step 1 and step 2, and people who are senior to you can always help you with this part. The most important work happens in identifying the case, doing a literature search to find something that's worth writing. Okay, so let me give you some more clinical examples, as I know most of you are clinicians, so this concept is easier to digest outside the settings of this exact case. Okay, so this is another case I wrote in residency. Now again, how common is pancreatitis? It's very, very common if you're thinking about it on a journal medicine floor, especially when you are in, Pakistan, where you have a lot of patients on your service. Okay, but to ultimately tie it to a very, very rare pathology like a lymphoma that's actually causing a pancreatitis, that can make it worth publishing. Okay, so this is the theme where it's a very common disease, but it's a rare etiology. Okay, so remember, there is a distinction when I say common disease, rare presentation. It could be rare symptoms, rare signs, rare association, or rare etiology. So this is an example of rare etiology. The first case was an example of rare association and rare presentation. Again, how many of you have seen cellulitis of the scalp? Those in dermatology see it every day. But to actually take the time to think through why a patient with Crohn's disease is getting recurrent cellulitis of the scalp, you just do a literature review, and it's easy to find these associations, that it's okay, there is an association. Okay. Now, those of us in cardiology, we see a cardiac tamponade not that infrequently. We see at least 2 or 3 cases in a month. Okay, some of these patients are on blood thinners, and at times we cannot identify any cause why there is sudden accumulation of fluid around the heart that's causing a patient to crash. So here we had a case like that. We did a literature search, and we were able to identify around 20 or so cases. Now, how do you make something interesting that has already been published 20 cases? Okay, because I think that the question mentioned here is excellent at the right time. So your question was how many case reports allows it to a case report. So this case had like 20 or I think 25 similar cases. So how do you make that interesting? Okay, you can always summarize all those cases, try to find patterns on those cases. Because for this specific condition, even from clinical trials and observational research, we don't know much about these patients. So for a clinician out there somewhere, he can either read those 28 cases separately if he has the time, although I'm telling you there will be very few clinicians who have the time to read 28 case reports before they're ready to apply on their patient, or they can read a systematic review of literature where somebody has already read those 28 cases, try to find common themes and patterns, and then summarize the highlights for you. Okay, so this is to answer your question. It's okay to be limited, but it's okay not to be fixated if they already had a lot of cases published. Okay, you can always find an interesting angle. Like in this case, the angle was a male patient with history of cancer and with use of apixaban, and then we used a literature review to basically highlight our point. Okay, and you can always publish interesting imaging findings. So for those of us in radiology or any other imaging modality, you can always publish imaging vignettes in your journals. Okay, so I'm going to take just 2 minutes to describe some basic ethics. Okay, because this often becomes an issue if you're working in a large team. In my mind, and if you read journals and the guidelines usually every hospital has for research, you as the primary clinician for the patient have the first right to identify that case and write it. But if you have failed to identify, and somebody, let's say on a consult team, has identified that as a case and the thought never crossed your mind, then it's okay to collaborate with them and let them write it. Because in my mind as a researcher, it's very important to respect whose original idea was it to write that case. And again, I know Dr. Naveed is very, very particular about these things, like follow through on your timelines. Otherwise, if you are writing these cases, they're never going to get published if you're not following through on the tasks you have promised to the rest of your teammates. Okay, so it's very important to be upfront about authorship issues. In general, the way I basically deal with this is if you are the writer of the first draft and it's a good draft, it's not a draft that has to be rewritten completely by the senior, then you deserve the first authorship. Middle authors can always help gather these tables, help you with search, put figures together, and format it according to a particular journal. And usually the senior most person who edits and reviews it is like the last author and the corresponding author. For case reports, it's really hard to justify that you need a team more than 4 unless you are doing something, like a systematic review along with your case report. Always good to find friends in radiology and pathology because they can give you those beautiful images that highlight your case and make it interesting and more meaningful. Okay, and again, cannot emphasize enough, every year I see the ratio of turning posters into papers, especially for interesting cases, that goes down tremendously. So you can always, I encourage you to start by putting your interesting cases just on a piece of paper, which is a poster, and we can probably do a lecture some other time on how to do a poster, but equally important to turn that into a published paper. Okay, so again, everybody starts with case reports. I started with case reports. I find immense value in them. If you are particular about your steps and a systematic approach, it's much easier. And again, one of your motives is to contribute to science and write it, but a very selfish aim for you to get involved in case reports is to break that mental barrier and actually get started on research. And, trust me, once you are done publishing a single case report successfully, all that mental barrier is gone. Now, this research thing won't be a big black hole for you. It's going to be something very, very simple and straightforward for you. Okay. Now, here is a quote I really love. It summarizes what is actually research. Okay. So it's the distance between an idea and its realization. Okay. So that gap is actually what research is. Okay. I'm going to take this opportunity very shamelessly to highlight how beautiful the medical center I work at is. So this is Oklahoma University Health Sciences Center. This is our new patient tower that was just completed like 6 months ago. This is our children's hospital. And this is an overview of University of Oklahoma. We have multiple campuses, like a public health college, a VA hospital, a whole building dedicated to research in rheumatology, library, at least 2 new bed towers, whole building for our clinic patients. And this is actually the Academic College of Medicine building. And with that, let me quickly answer more questions before I open the floor to your questions, where you're welcome to interact with me. So collaborate in research writing. Okay, so let me go one by one. So how do we identify which journal to submit? Excellent question. It's very easy. You just see which journals have published similar enough cases, and then you first try to target those particular journals. But in this today's day and age, there is really no shortage of journals. You just have to identify a journal based on how interesting you think your case is. Here, it's okay to play with numbers a little bit. Like if you are reporting the 3rd or 4th case, it can potentially go to a high tier journal, as opposed to if there are multiple cases and your angle is the journal is honestly the last step, basically, in your search. And at this point, your mentors or anybody else can help you with this process. Okay. So it's basically a lot of Dr. Google's input involved. You open a journal, you see their submission requirements, you see if they have published something similar, if they're asking you for money, and then you can basically make a decision. Okay. Will you be able to collaborate in research writing? So for case reports, I always encourage involve a specialist. Okay, like if it's a cardiology focused case report and you have already done your homework, step 1, step 2, good to involve some resident or a fellow or your local faculty. Always encourage, always involve your local faculty. They have some valuable clinical input. Okay. And then yes, in terms of editing, the last steps, the fine tuning, improving the flow, improving the language, absolutely I can help. And I'm sure everybody else in the research council can help you, but don't just skip to step 3. Okay. Do a good job at step 1, step 2, involving your local faculty, and then move to step 3. And we are always looking to help you. Absolutely agree. This is a beautiful campus. That's the reason I'm here 7 years and hoping to stay here for a long time. In general, you don't need IRB approval for case reports. You can look at journal requirements. Most journals require you to fill a form from the patient. Okay. And that's why important to do these things in real time. So you have the patient there and have them sign the form. Okay, to sign it for multiple journals, since you won't know where it will get accepted. Extremely important to remove as many patient identifiers as you can. So it's not a HIPAA violation. For those of you not very familiar with HIPAA, in a nutshell, it means somebody should not be able to read that case report and actually identify that patient. Okay. Okay, I think I've answered Dr. Zishan's question. Yes, I'm sure we can have the recording available. And now, I will encourage, if you want to interact, ask questions in person, in addition to the chat, you are more than welcome. Okay. I think we'll have to find the unmute button.
So if you can raise your hand on the right-hand side in the bar dispense, there should be an option to raise your hand. Or if you can't find that, just you can just speak up, and anyone can ask a question. Dr. Iram Khan.
Assalamu alaikum. I just have one question. What do you think should be the timeline to start and end a case report? Ideally should it take? I know for the beginners it's going to be a little bit longer, but for a for an interesting case, how long should be the deadline for?
I think important to identify the case while you are seeing the case. Like if you're seeing an interesting case that's admitted to your medicine service or somebody you saw in clinic that day and ordering some investigations, that evening, do your literature review and see if that's something interesting. Or when you get your diagnostics back and you have verified that whatever interesting thing you were thinking that's there, do a literature review that particular day, and then clinically indicate or rule out your differentials and all that, and write that single page which I mentioned. What makes your case unique and meaningful to the scientific community? Okay. Once you have that page written, after that, it's fine to take your time. You can take up to 1 or 2 months, because I know as you're getting started, it's going to take you some time. I was lucky my case had 3 previously published. Maybe you have to go through 15 published cases. And I realize the limitations. Maybe you don't have access to all those journals back home, and you're waiting to hear back from somebody here for collaboration. After that, things are not that time sensitive. But in my very limited experience, if you have waited more than 3 months, then just be real to yourself. It's not happening. You're never going to write that case. Okay. So summarize, do step 1 and step 2 quickly. For the third, it's okay to take a couple of months or even 3 months. Important to do a good job and in writing your first draft when you send it to somebody, rather than just rushing it and then having them do the bulk of the task.
Thank you. Good enough. Thank you.
Okay, there is a good question here. What are some people who don't charge a fee for case reports? Yeah, that's an important question. I am honestly familiar with the journals in my field, cardiology. Medicine, there are few journals. American Journal of Medical Sciences was the one I showed you where that diabetic ketoacidosis case was published. Every major society have their own journals which at times publish case reports. One hard thing is a lot of good journals are no longer publishing case reports. They focus on original research and all that. But in this day and age, you just have to sit in front of a computer and keep digging. Finding a journal is one of the very, very easier parts of this all process. Okay. And initially, give your best try to get it into a decent journal, even if it means you have to submit it 10 different times. Okay. I won't name any predatory journals, but I'm sure everybody knows which journal I'm talking about, but don't just put all your hard work and throw it in that journal with minimal effort just to save some time. Okay. Okay, let me see if there are any other questions here.
Hello, Dr. Asad.
Hi.
Namaste. So I had to ask you one question. Since I myself am a medical officer and I'm not currently working in a higher medical, tertiary medical center, so I might not be having all the investigations done at my center. So if I get the patient referred to a higher center, and will that be, can I publish that?
Absolutely. Absolutely. Like, let me give you an example. And that's some cases I saw during medical school. Like we had a very interesting presentation of like tuberculosis. I remember half the details now. But that patient had like histology and pathology at like a different center, specialized MRI at someplace else. So that's an excellent opportunity to actually collaborate. Okay. Like if your diagnostics or imaging or histopathology is going somewhere else, always involve them. Okay. Invite them, get the slides, absolutely put their name on the paper, get their input. That's an excellent opportunity to collaborate even for your future cases.
Thank you. Thank you so much.
I think I saw Muhammad Tahir's hand. Let me just ask to unmute. Tahir, go ahead. Let's see.
I think IRB question we answered a minute ago that no, just remove all the identifiers. You really don't need IRB permission, at least in my institution. I am very confident it's similar in other institutions just for a case report. But extremely, extremely important to remove patient identifiers and obtain patient's permission, because to my knowledge, most journals have a template of the form they want the patient to sign, and they want that form to be submitted along with your paper.
And Zain, what would you suggest, because some of the people who are in India, Pakistan, or other, in a developing country to publish, the local journals, any thoughts, any?
I am honestly not very familiar with the local journals back there, because when I looked at that topic, there were very few PubMed indexed, and the ones that were PubMed indexed were asking for some, submission and article processing charges. Not huge amounts, but again, I think as a stepping stone, it's perfectly acceptable to do that. And if you're having trouble getting into higher impact journals from here, just go ahead and do that.
So if I can answer that question, so I think in Pakistan's scenario, Journal of Postgraduate Medical, JPMA, PGMS, Annals of King Edward Medical College, they're all PubMed index, but the issue with them is, like Zain mentioned, is the article processing charges. And if you're student or resident, you may not have that that fee to pay. So but look for all the journals. Obviously, you want to start with the highest impact factor and go down from there. And the highest impact factor of any of the journal of Pakistan is 0.6, and that is JPMA. So that is low compared to the other opportunities that you can have.
Thank you, Dr. Naveed. I think Iram Khan has her hand raised. Yes.
Yes. Yes. One more question. It's I'm going to start my residency in psychiatry pretty soon. So my question is it possible to go back to a case that you have seen in the past and do a case report on them? I mean, obviously it's related to psychiatry.
Yeah, absolutely. I have done that. I have done that for, cases or institutions I'm no longer involved with. So it's good to, go back to the people who were working with you on the team, and that can, put together the case specific information, like the case summary part, and you can help with the intro and discussion part, because there are some hospital level and other legal issues involved in accessing their EMR. So as long as they can give you some de-identified case specific summary, you can always work on the scholarly parts and publish that. And it's always good to, the way I do it is keep a library of cases that you think are interesting. And even if you don't have a lot of time that day or that week, you can always go back and, do a full search to see if it's interesting. So to answer your question, yes, absolutely possible, as long as you take care of all the legal and HIPAA and IRB issues. So best to involve local people there. All right, we have one more question, I think.
Thank you very much.
Sadia Usmani.
Thank you, Dr. Zain. It was a great presentation. I just have a question just connected to Dr. Iram's question. My question is that if we do go back to our old cases, how do we get the consent from the patient? Because at that point we have, the patient is not there.
Yeah, so the way I have tackled this is, again, get help from local people. Like, if somebody on that team is now that patient's primary care, so just shoot them an email that the next time the patient comes for his visit, have them sign that, patient permission or consent. Again, at times depends on how your relationship was with the patient. If it's an interesting case, somebody you really helped, at times it's okay to contact the patient specifically for this, because, in my experience, some patients are actually very happy that their case can be a learning experience for others and can help others. But, again, you have to assess that on a patient by patient basis.
Okay, thank you so much. Thanks.
Okay, one more question we have. All right, go ahead.
Nabiha Musa. Yeah.
Thank you, Dr. Asad, for the presentation. I had a question just in line with what Dr. Sadia just discussed. If we are looking at a case in the past and we're not identifying or sharing information which can identify a patient, do we still need to have a consent or go for a consent?
Okay, good question. So one thing I'm really happy about that after this presentation, people have started to think about the previous interesting cases they saw. So that's a good impact. Okay. So to answer your question, some journals need that consent and that permission, and some journals do not need it. Okay. So a good way to tackle that is just prepare your homework, see if it is all possible that that patient is seeing somebody in clinic in the next few weeks or months, and you can get them. But if there is no way to obtain consent again, and you have done your good job at your HIPAA compliant, you have removed all identifiers, and the journal you are publishing in does not need permission, then you can go ahead and submit. I think at least 3 of the cases that I shared here were from journals that don't need a consent signed from the patient, okay? Because you are removing all the patient identifiers from your case.
So one suggestion that I have is that probably, if you have a case and before you start working on that case and you start organizing your stuff and start write a query to the journal and ask them that you have really interesting case, but you don't have consent. So can you still proceed? I had this patient with, haloperidol induced liver injury, and patient actually passed away. So I did not get a chance to get the consent from the patient, obviously, and it was an adult patient. So it was really hard to track, the guardian. So I just wrote it to the journal and I asked them, this is what happened. I have this interesting case. Can I write it up? So they were actually in favor of me writing that case up.
Okay, let me quickly answer that next question. Similar for case series. So case series is going to be exactly same. Okay, instead of the case presentation section, you're just going to briefly summarize all the cases you have and put together good tables and good illustrations. And most of the points that I'm telling you, I am like a senior reviewer for European Heart Journal, the case reports one. So I review about 3 to 4 case reports every month. That's a very decent journal. Your case makes, as a reviewer, your case makes a lot of impact. I know we tend to emphasize a lot on how much makeup is that on the case, how well it is presented and all that. But every reviewer is different. At least for me, if you have the good sound scientific basis to your case, I'm a little forgiving on the presentation part of it. And again, the step 3, how well it is written, how well are the figures made, anyone else can help you with that. Like your senior people, your native English speakers, anyone can help you with that particular element. That's not the main thing. The main thing, again, is going back to step 1, if you really have substance in your case. Okay, to summarize, for case series, it's going to be similar. You're going to be more mindful for your tables and figures and how you're summarizing and finding themes in your cases. Okay, and always good to read tons of examples of case reports and case series similar to your case.
So no, thank you so much, Zain. I think one thing that commonly happens, especially people who don't have lot of experience. Let me just have, I think Nabiha raised her hand. I think let me just have ask the question. Yes, Nabiha, go ahead, please.
Thank you, Dr. Sadiq and Dr. Asad. I just had a question in continuation with Dr. Sadiq. Answer was that as students, we're not aware about which journals to submit to or how to approach in the first place, especially when it comes to medical school, when we do get to see cases. So in that case, or someone who's starting this as an initial